We're here at Alexiou Hearing and Sinus Center with Dr. Kristen Seawall. And Kristen, you have been doing for some time free screenings with appointments. Tell us what you're finding out. Why are people coming in for this?
I've had several patients come in to see us mostly because a family member might suggest they've seen the commercial and they're thinking, you know, you've been asking me to repeat what I say or asking what or huh very often, and so they'll send a family member in sometimes. Other patients have wanted a baseline to determine if their hearing is normal, to keep it on record for future reference should their hearing change. Some patients have called knowing a family member may have hearing loss. They'll call and say, you know, my mother has hearing loss and I wonder if I might have a hearing loss. They've come in as well. I would also say I think because it's been on television, they're thinking, you know, they might be turning the TV up, or a family member is telling them you need to turn it down, and so it's coming to their attention that maybe they have a hearing loss. So by doing a screening, we can sort of rule out whether or not there's something to look into, and by doing it by free, patients feel they can come in, find out if there's a problem, and if not, it's very quick and easy.
Well, my counterparts taping here today have actually asked me if I did have a hearing loss that would require a hearing aid, would I have a problem with that? And when I look at this tiny little thing, I think no. In fact, kind of show us a couple of options.
A lot of people, when they think of hearing aids, they think of a classic style device that fills the ear. And although there is an appropriate time to use this type of hearing aid, it doesn't appeal to my younger patients like yourself who would want something perhaps more cosmetically appealing. This is considered a behind the ear hearing aid that takes the device and puts it behind the ear, and then a small earpiece comes down and goes into the ear. The reason this is so popular is that looking from the front, most people cannot see the earpiece at all, or even the wire in the ear. The part that goes behind the ear, often your hair can cover it, and we'll do it in a hair color, or even match it up with the arm of if you wear an eyeglass, make it look like part of your eyeglasses. Yeah. So cosmetically, there are options now for patients that they feel more comfortable wearing a hearing aid.
Yeah, I can't imagine that anybody would choose for, you know, cosmetic reasons not to go with something like that.
Sure.
Now show us some of the other devices, the remote devices that people are using to watch television and some of the other things.
With a hearing aid like this, you can have in it essentially an antenna or a form of communication to make it wireless to connect with other devices. So for example, you can have a box that we refer to as a TV streamer that you would connect to your television. When you're seated in front of the TV, you can press a button and actually take the signal directly from the TV and hear it in both ears, which is fantastic because the people in the room watching with you can set the volume where they like it, and you can have it where you need it for your hearing loss. And we're getting great reviews as far as the clarity being better that patients feel when they use the television streamer. They can understand things much better.
That's just amazing.
In addition, you can have items like a phone clip, which works the same way. You would wear it, and it has a Bluetooth option to connect with your cell phone. So when you take a cell phone call, you can go ahead and just press a button on this phone clip and hear the call in the hearing aids rather than having to pick up your cell phone or get the cell phone to talk to the hearing aid. It actually puts the devices in communication with each other and puts the phone call in two ears. So it actually sounds a lot better and can allow you to be hands-free when you're driving. So this is another option. In addition, you can also get one of the most recently added items is a microphone that you can hand to another person. So for example, if we were at a restaurant, I could be wearing it across the table from you, and then you can hear just my voice. There would still be some background noise, but it would certainly cut it down and help you to hear better in a noisy environment. I have several patients who enjoy this if they're on a road trip in a car, where a family member can be wearing it so that the driver can keep their eyes on the road and the person can get more information, since they won't be able to watch their lips as closely, especially if they're trying to drive.
Well, and we're going to show people how quick and easy it is because I'm actually going to have a screening right now.
All right. The first thing I would do is take a look in both your ears to check for wax, which some wax is normal, and of course we want to see some healthy wax, but we don't want it to be impacting the ear canal where you would not hear sound. And so both your ears are clear, and I can see down to your eardrum. So when we can see to the eardrum, we know it's all right to do a full test on you, and in this case we're going to do a screening where we'd give you some earphones. So I would rest these over your shoulders like so, and we'll put an earphone in each ear, and then what we would do is after I get both earphones in, I'm going to hand you a button and ask you to press the button anytime you hear a beeping sound, and I am looking for the softest sounds you hear. So it's all right to push the button even if the sounds are very quiet. Okay. We're going to begin with those sounds on the left side. So anytime you hear a beeping sound, you can go ahead and press the button.
So, Dr. Sewall, what did the screening reveal?
When we look at a screening, we want to determine whether or not you can hear sounds softer than 25 decibels. So if I have to turn the sounds louder than 25 decibels, it's an indicator that you may be having difficulty hearing. So we marked your left ear in blue X's, and we mark your right ear in red circles. And what we're finding is, if we look at where 25 is, all of the symbols should be above the 25 decibel marker line. And yours are, except for just one frequency. So this would indicate that there might be an issue with hearing loss. In this case, we would want to investigate further what type of loss this might be, because we're not seeing anything in the ear canal. The next thing would be to consider whether or not there could be some fluid behind the eardrum that might be causing this, or to determine whether or not this could be nerve damage. And that would be found out on a full hearing evaluation, where we look at what type of hearing loss you might have.
Well, it looks like I'm headed for a full examination then.
Looks like you are.
Alexiou Hearing and Sinus Center.
Huh?
Alexiou Hearing and Sinus Center.
What?
Alexiou Hearing and Sinus Center. You need to get your hearing checked. I know what you're thinking, but hearing aids aren't what they used to be. The technology is so small, and with the right adjustment, you can virtually eliminate background noise. And adjustments are free for the life of your device. So don't you think it's time to take care of your hearing?
Sounds like I need to call Alexiou Hearing and Sinus Center.